Topic: First aid. First aid is the assistance given to a victim of accident or sudden illness in order to prevent worsening of conditions before the services of a qualified doctor or physician. Objective of first aid: 1. To preserve life. 2. To aid recovery and reduce pain. 3. To prevent the individual from further harm. 4. To make injured or ill persons comfortable as possible. Bleeding. Bleeding is also known as hemorrhage, and it is caused by acute or punctured blood vessels. Bleeding is stopped or at least slowed in an open wound by 1. Washing and dressing the wound. 2. Applying direct pressure over and around the wound. 3. Applying pressure at the pressure point. 4. Application of iodine or methylated spirits. First aid treatment to bleeding. 1. Wash your hands before dealing with the cut. 2. If the wound has dirt, rinse it with clean water. 3. Place a clean pad or cloth on the wound. 4. When bleeding stops, firmly apply a dressing, iodine or spirits. Artificial respiration. This is first introduction of air into the lungs of someone who has stopped breathing or of a suffocated person. It is administered by mouth-to-mouth or mouth-to-mouth resuscitation. Procedure: 1. Lie the victim's back. 2. Loosen all their wares. 3. Tilt the head as far back as possible. 4. Pull joints forward and open mouth. 5. Examine the mouth and the pharynx. 6. Open your mouth wide. 7. Place over the victim's mouth. 8. Close the victim's nostrils. 9. Take a deep breath and blow in the victim's mouth gently. Injuries to bones and joints. 1. Fracture. A fracture is a break in bone usually caused by accident. There is usually swelling and tenderness at a site of the fracture, which may be external or internal. First aid treatment for a fracture. 1. Keep the injured limb steady. 2. In case of broken arm, apply a pad or a splint. 3. Reduce environmental stress and avoid shock. 4. For a broken leg, apply a pad and splint beside the broken legs. Dislocation. This is a complete displacement of two bones in a joint. Dislocation. This is a complete displacement of the two bones in a joint so that they are no longer in contact, usually as a result of injury. Signs of dislocation includes pain at affected joints, swelling around the affected joints, loss of function of the affected limb, deformity, and complications in joints. First aid treatment for dislocations. 1. Support a dislocated joint with a splint or tie the legs with bandage. 2. Apply ice or cold water. 2. Apply ice or cold water to the swelling. 3. Take the patient to the hospital immediately. Sprain. This is the tearing or stretching of the ligaments that holds together the bone. Signs of sprain. 1. Swelling of joints. 2. Increased pain with movement of limbs. 3. Muscle spasm. First aid treatment for sprain. 1. Apply an ice pack to reduce the swelling. 2. Compress the joint. 2. Compress the joint with an elastic bandage. 3. Rest the limb in an elevated position. That will bring us to the end of first aid.